Welcome back. In your morning medical news, it is the second leading cause of death for young people between the ages of 10 and 34, according to the CDC. But suicide can affect people of all ages and backgrounds, and new research suggests economic and social conditions may be a contributing factor. Mandy Gaither has a look at the report and explains what can be done to help prevent youth suicides.
It's a serious public health problem. In the latest data, the CDC says suicide was responsible for the deaths of more than 49,000 people in 2022.
It's a largely preventable form of death, so we have a lot of opportunity to reduce those numbers, but they are high.
A new CDC report is providing more evidence that social and economic conditions play a significant role in efforts to prevent suicide. Researchers found suicide rates in 2022 were 26% lower in counties with the highest health insurance coverage, 44% lower in counties where most homes have broadband internet access, and 13% lower in counties with the most household income.
Increased access to healthcare and especially mental health care and making that affordable is something that matters a lot.
Dr. John Ackerman with Nationwide Children's Hospital says communities need to play a role in suicide prevention, and so do parents. He says to talk to children about suicide.
It's been shown that we don't increase the risk of suicide when we ask a question like, have you ever thought about ending your life? Or have you had kids in your classroom that are struggling with harming themselves or saying that they don't want to be alive.
Ackerman says it's also important to safely store unsafe objects in the home, including medication and firearms, and make sure children get involved in things they care about.
They're fostering opportunities to grow and learn and make connections, and that they know that they're not alone.
And if anyone is struggling with thoughts of harming themselves, there's help available 24/7. Just call or text the Suicide and Crisis Lifeline. That number is 988. New research is providing scientific evidence for pregnancy brain. A study compared brain changes in a first-time mother to 8 non-pregnant women. The pregnant women showed decreases in brain tissues controlling speech, thinking, and memory, but increases in areas for communication and information processing. Researchers call these changes normal and healthy. Some reverted by 2 months postpartum. Others lasted for up to 2 years after birth. The authors caution, though, more research is needed. It is the third week in September, meaning today kicks off what experts call Asthma Peak Week. If you're one of the more than 25 million people in the U.S. living with that condition, this time of year can be dangerous. Mandy Gaither has more with an allergist on how to prevent an attack.
Fall is in the air, and so is large amounts of ragweed, which can be especially dangerous for those living with asthma.
This is actually a time when asthma flare-ups and hospitalizations tend to significantly increase, and especially in our children.
Dr. Sandra Hong with Cleveland Clinic says high levels of allergens, along with exposure to common respiratory viruses, combine to create a potential problem for asthma sufferers, but she says you can help prevent symptoms from getting worse.
You need to touch base with your healthcare providers to create an asthma action plan.
That will include personalized ways to control asthma, which medications to take, when to take them, and when to seek emergency care if symptoms get worse. Next, have medications ready.
If for some reason during the summertime you stopped taking them or you forgot to take them, I would say please get back on your controller medications.
Finally, Hong says to know your triggers and work to avoid them. Stay indoors during high pollen count times, keep pets that have been outside off the bed, and be aware of mold exposure if you've been walking in fallen leaves.
Although asthma is a chronic condition, you can absolutely do things to prevent it from controlling your life. So it's really important to stay healthy, stay informed, and take care of your lungs.
Doctors also say it's important to lower your risk of becoming severely sick from respiratory viruses by making sure you get the flu and COVID-19 vaccine.